All right. Now, I see that people are starting to join in, which is great. I'm gonna give everybody a minute to get logged in. For those of you who do not know, my name is Ginger. I'm the Executive Director of Connectionology Seminars of America. We are so excited to have you with us today. This is a very unique and very important topic that we're going to be talking about today. I was just telling Blue and Dr. Smallwood, out of all the webinars that we've done with Connectionology, we have never covered this. And I've actually not seen any of the other companies and seminar companies cover this as well, but it's very, very important. So you're going to learn a lot. We highly suggest you guys to think of some questions that you would like to ask. You can put those in the chat box. You can put them in the Q&A box. We'll keep an eye on that as well. And then later on in the webinar, you're going to meet my amazing partners over at On Point Legal Nurse Consulting, FAACD, Emotion Track. And then, of course, we're going to have Blue say some words about HMR. We love working with that company. And again, at the very end, you're going to meet Ted. Well, I don't think Ted really needs an introduction at this point, but he's going to be giving away all the coffee to one special winner at the very end of this webinar. So let's get started. We have a lot we're going to be talking about. Very honored to have Blue with us today because he is actually going to be helping moderate this webinar. And he, as you guys know, is a Colorado native. He is now enjoying the scorching heat out of Scottsdale, Arizona. Although Blue, I think we have you beat here in Florida because it is very hot. Um, some neat facts about Blue is he actually was a firefighter for over 10 years, and he was a medic, and he was a wildland crew boss, a technical rescue technician, and a high angle rescue technician. He was an Arizona vehicle I think I'm saying this, extrication, is that right? Academy,
Yep, extrication. Yep.
and Swift Water Rescue team member. So that's pretty cool. And this is all before he started working with HMR. So his passion is definitely to help a lot of those who have been wrongfully injured. He continues from firefighting to litigation funding now. He's moved over to the litigation funding space 7 years ago. And now he has a lot of time to help support personal injury attorneys as well as the plaintiffs nationwide by helping provide funding that is needed for a lot of these case costs, as well as medical needs and personal living expenses through everyone's hard time. And in his free time, he enjoys mountain biking, rock climbing, golfing, wake surfing, and long walks on the beach.
Got to do the long walks on the beach.
Everybody loves those, right?
That's right.
So Blue, it is such an honor to have you again with us today and for you to be doing the special introduction of Dr. Smallwood. And please let us know again what that connection is, because I think it's pretty cool.
Awesome. Thank you, Ginger. And it's wonderful to be here with everyone today. And it is my pleasure to introduce Dr. Trent Smallwood, also a good friend of mine here locally with me out of Scottsdale, Arizona, enjoying the heat as well. You can probably tell by his wonderful tan when he when he joins us that and we are friends, so there will be some back and forth between Trent and I. But let me introduce him officially. Dr. Smallwood is a DDS, FACE, and PC, excuse me. His speaking and lecturing assignments include international speaker and lecturer. He's done over 1,000 plus speaking engagements nationwide, and even overseas. He's done a bit over there, including Top Gun seminars, Neodent Clinical Mastery Group, Nobel BioCare Clinical Mastery Group, BioHorizons Clinical Mastery Group. He currently sits on the Academy of Comprehensive Aesthetics, also known as ACE. Dr. Smallwood has published multiple articles, including the Journal of Cosmetic Dentistry, multiple memberships, and I know, Trent, I'm not going to get into anything else of your credentials. The list is too long, but I will go ahead and turn it over to you. And we are definitely looking forward to this. And I want to say up front that I think this is something that is not identified within personal injury cases enough. And one of the things that Dr. Smallwood is going to go over today with us is he's actually going to go through and show the value that is attached to these different kinds of injuries and kind of explain, what it's going to cost in the future medicals and things like that. So with that being said, Dr. Smallwood, take it from here, sir.
Blue, thank you very, very much. And I have to, really, after hearing all of the things that you kind of mentioned about me, I do appreciate all those, but it makes me feel extremely old. I've done a lot of things in dentistry. 30 years I've got in this industry. And I know, based on talking to Blue and Ginger, that maybe this type of webinar is a little different than some of the things you've watched and looked at before, but I hope to make it kind of fun and entertaining at the same time, to kind of look at a different perspective, like what Blue is saying, because with personal injury, there is a lot that we don't see, I think, with regard to the oral environment. I mean, this is a very expensive area to deal with regard to teeth, not just in looking good, but also in the functionality of your dentition. I'm going to kind of talk about how personal injury deals with that in a lot of ways. A lot of cases that I do deal with the reconstruction of those type of accidents that occur, and I will say that I've seen some real pain and suffering with patients and what they've had to go through for lack of teeth or pain associated with teeth. But to give you a little bit of a background with me, aside from all the credentials that Blue mentioned, I appreciate you mentioning all those, Blue. Dentistry has been my passion for a number of years, and I've been doing this just about 30 years, which is dating me even further, I think. But I have really enjoyed it. I've seen a tremendous evolution in the whole idea of where dentistry has gone. Kind of just a picture of my office here. I'm in Tempe, Arizona. I live in Scottsdale, but Blue and I are up in the same area up in North Scottsdale. But it's wonderful blue skies like this all the time. To give Ginger kind of a bad time, there is a difference between the dry heat that we get here and the very wet and humid heat that she gets in Florida. So I can identify, as much as I love Florida, it is humid there. We do not get that here that often. And when we do, Blue, right, it's rough because we're not used to it at all. So this is kind of where I feel like all my magic happen, and this is putting people back together, which I really enjoy, or enhancing their function of their teeth, or they're just making them smile again. And a lot of that is just voluntary, and a lot of it is traumatic, unfortunately. But I'm able to really do some incredible things with teeth. Here on the lower left, you can see kind of where teeth started with me, where I would just get kind of teeth in there. I would just hope that they looked okay. Didn't have too much of a care of the aesthetics. I just wanted to be able to get people to eat again. And in that 30 years, we've evolved to where we have just beautiful smiles that you can't tell that these are all fake. And that's the idea, is to kind of trick the public into thinking that what you've got in the mouth is real when it's not. And so dentistry, as most industries, have evolved tremendously over the years, and you'll get a chance to kind of see where my journey has been throughout the years, from placement of implants to veneers to crowns to even the movement of teeth with things like SureSmile or Invisalign. Some of you have probably heard about those, but all of those can be used to treat personal injury cases. And like what Blue was saying, I think that so many, so often in regard to protecting your client, again, whether it's on the defensive or the plaintiff side of it, is if a patient or a person is injured in some way, and they may have other issues that are the bigger items to look at, like orthopedic issues, neuro issues, there are a whole gamut of different things that could affect them. But their teeth are often in an environment that is not widely looked at, or not close enough. And not that it necessarily needs to be an injury to the face that would necessitate remedy with regard to dental procedures, but it could be something to where it's a secondary injury to something else that happened. I think if it's missed, then it can really lead to some issues and suffering for that patient. And of course, as wonderful attorneys as most of you are on this call, I would imagine that your idea is to be able to represent the best that you can for your client. And there are some very, very complex procedures, or simple ones, that are associated with personal injury, and we've seen them, and they come in so many different ways and methods. And these are just a few examples of ones that I know of, that occupational issues. Of course, car accidents are probably a very common thing. Work-related items, or people even just falling. All of these can have an effect on the legality of the patient's rights and I apologize, I keep referring to as patients. I think of all my patients as patients, but they are people that have these various issues that need to be remedied, and as best that we can to make them whole. I, of course, am on the more clinical side, and you guys are more on the legal angle of it, but those do both kind of cross over each other a lot. And so I want to just kind of recognize that a little bit. When I think of trauma, because I deal with a lot of trauma cases, of course, the obvious ones are the ones where we see a physical manifestation. And even Bleu, when you're a fireman, you probably dealt with this a lot, where people in personal injury issues with car accidents and whatnot, you're basically cleaning up pileups on the freeways. Sometimes you will see a lot of these type of things, which are very relevant. They're the most common things that we see right up front. They're kind of the first through the door, so to speak. But the dental items are usually a little bit more hidden. Sometimes you probably put people back together with broken legs and arms and whatnot, and then before you know it, you notice their front two teeth were broken out. That was the last thing you noticed. And so those are the type of things that we have to look at too, because though contusions and bone fractures and even brain injuries, these can be very, very substantial issues for the patient. Swelling to disfigurement are all very, very important, but there is a dental angle to this that may be more of a secondary value to the patient, as well as the case that you're trying to put together. And when I look at that, as Bleu kind of alluded to, I look at kind of the overall aspect of dentistry plays into this with regard to not just what is done in the immediate moment to fix a patient or make them whole. You have to kind of look at the lifetime of these things. And for example, you may look at this in a person that needs a new hip as a result of an accident, potentially. Well, that hip may need to be replaced again in their lifetime at some point. And you've got to try to allow for that and predict for it in your settlements. I would imagine if a 22-year-old needs a new hip at that age, there's probably a pretty good chance they're going to need to have it replaced again once or twice in their lifetime. And that's an important responsibility.
And Trent, let me jump in here real quick.
Sure.
And I want everyone to understand as well that Dr. Smallwood has been on multiple plaintiff as well as defense cases as an expert, right?
Yeah.
So with that being said, you know, throughout this presentation, if you guys have any questions, put them in the chat box. I've already talked with Trent. I'll stop him and we can get those questions answered throughout. So just wanted to throw that out there.
I appreciate that, Bleu. Yeah. So from at least a dental standpoint, you have to look at the cost to replace it initially, but then we have to look at the lifetime expense. For example, those of you on the call that have ever had a crown done on a tooth or a veneer or maybe an implant, chances are that will need some maintenance or potentially a replacement in your lifetime. It's not just a one-time thing. I mean, ideally it is, but it's not really realistic. You're not going to buy one car at 20 and have it until the day you die. I mean, it's typically something we're going to have multiple cars in the span of a lifetime, and teeth are really no different. And as are hips or knees or zygomas of the facial arch, bony fractures. I mean, there's all sorts of different things that we have to look at. And then I look at, which is not as much in my area, but the quality of life. I mean, if somebody's missing 2 front teeth, that can affect them getting a job. It can affect them being able to speak properly. Ironically enough, F's, S's, and T's are primarily formed by the 2 front teeth or the central incisors. And if you don't have those, you're not talking normally, you know. So how is that remedied, and how does that affect your potential of getting a job? I mean, what if you were in an accident and the next day you're supposed to have a big interview for a top 500 company? I mean, those can all affect you in whether you get the job or not based on teeth. So we look at those kind of things. And then of course the loss of time is, some of you probably have had to spend some time in the dental chair. It took time away from work. So these are all things that we have to factor and look at a little bit. I want to break that down a little bit because there's a number of things that do affect us and kind of the residual aspect of restorative dentistry. And for example, a crown, many of you, I feel like probably know what that is. It's where a tooth maybe is broken down enough where you've ever had to have a crown. Bleu, have you ever had to have a crown?
No, I've been fortunate enough not to.
I'm proud of you. Good. That's great. And you know, these are all based on fractures. They're based on maybe neglect. They're based on genetics. Some people are very prone to cavities, and they just get cavities every time, even though they never have sugar in their diet. I mean, that's just something I see in my industry all the time. But to replace a crown, you're looking at about $1,500, give or take, depending on the region. But then that person's going to have that replaced 2 or 3 times, probably in their lifetime, depending on when they get it. And then I don't really look at a quality of life or factor in that regard, because it's not necessarily improving anything if it's a back tooth or just a functional tooth. But then the loss of time out of work to get that crown done can have, over time, the initial $1,500 to put it in, but then you need about $8,000 to residualize it over time. Now, you may have insurance to cover these things and other kind of third parties that can help you with that expense, but you multiply this times 32 teeth that are in the average human's mouth. That's a big number. I mean, we're approaching, potentially $250,000 there. So that is a substantial, of course, that's every tooth in the mouth. Not necessarily is trauma going to require that, but that's an extreme example of what I'm talking about. And that does add up. So we have to look at these things, and to break it down a little bit further, not unusual for some sort of trauma, accidents, work-related fractures. I had a guy not too long ago, that construction worker, and he's pounding a nail in, and somehow on his kind of backswing with a hammer, he just hit his 2 front teeth and broke them, just like this situation right here. And he's been in construction for 20 years. It's not a normal mistake for him, but it happened. I mean, not to keep going back to you, Bleu, but as a fireman, you guys have tremendous risks. I'm sure some of the firemen got in situations where they got hurt, right?
Absolutely. Yeah, it happens often.
So there's occupational hazards out there in certain job-related type of occupations that can affect you also. And of course, I mean, I would imagine car accidents are a big part of what a lot of people on the call will do. And any form of personal injury, of course, that list is extensive, but teeth will often be a big factor in that. Even what you see on the upper right here, a fracture in the middle of a tooth. This may not seem bad to many of you, but that is a tooth that now will have to be removed, and then an implant possibly placed. And that expense is going to be anywhere around $6,000 to probably $9,000. That's a big item, and a lot of lost time before the tooth is restored fully. So tooth fractures are a very, very common part of it. And this can happen in a lot of ways. The obvious is when, for example, if this guy had hit the steering wheel in a head-on accident, he could potentially lose these 2 front teeth or fracture them to the point where they need to be restored. But what is most common, I will say, probably over 60% of the time, is when somebody breaks teeth like this, they come down so hard on their bite that their many back teeth can break or become endodontically treatable teeth, which means that the nerve has died in those teeth and they would need a root canal. Many of you probably have heard that term before. And that's not something that's always so obvious right away. It can be obvious then months, if not years later. And by then the case is already settled. I mean, that can be an issue as well. So these are all big factors that can really end up affecting the outcome of a settlement among one of many parts of a personal injury.
And to that point, Trent, I think it's important that this is something that is included, right? Before the case is settled, right? Because after the fact, it's too late. And I do want to point out I mean, if you guys look at those totals, the total over lifetime, I mean, $460,000 is no small amount of money, right? And I know that, a lot of the focus is on spine and TBI, and as it should be, right? Those are huge things. But I feel like this is something that is often missed or not talked about. So I'm really glad that we're actually attaching some numbers here to what we're looking at. So go ahead, Trent.
And you're right. Like this 460 is pretty extreme situation, and it's also not necessarily to get that person whole, but a whole for a lifetime. And how do you place a value on that? That's not the easiest thing. If somebody loses an arm, what is the value over a lifetime to have that arm back? I mean, he'll never have that arm back. So how do you make that whole? Is it worth 1 million, 50 million? I don't know what that number is. I don't think we really do. So I mean, some of these are just kind of ideas and estimates, but for you, as a lot of litigation, I would imagine, you have to at some point attach a number to these. And so this is just where, for example, my area of expertise is looking at not just today, but looking at tomorrow also. And this is where I have been asked many times up on the stand, what will this cost this person over the rest of his life to be able to maintain it? And it's weird because it's not a question we used to ask. We just used to ask ourselves, what does it cost to get him fixed today? But not necessarily when this eventually wears out, then he has to have it done again. Well, whose fault is that? It's usually the initial injury that caused it. So we have to look at all of that because there is a big factor that looks at today and tomorrow. And these are just kind of examples. Avulsion is where, for example, if you're hit, but the tooth didn't break, it just got pushed out or pushed into either backward, which we call retroclined, or intruded upward into the gum, or extruded out of the gum, like you kind of see here. All of these can be factors then that will lead to a mouthful of potential implants, which some of you may even have single implants in your own mouths, and you probably will remember that there's a process to that, and it's not a cheap process either. So that's kind of where I put some ideas of more or less kind of where this could go. And again, I know it's very difficult because are we talking about one tooth or 26 teeth? I mean, there are varying degrees of trauma that occur. So it's specific to each particular case. No case is really ever the same, but this is a common thing that we see in trauma with avulsions. And like we've talked about before, and many of you probably have a very standard crowns are a way to be able to restore a tooth back to normal. If it's been fractured, if you've had decay on the teeth, neglect, pulpal issues where the nerve has died, all sorts of things crowns will fix to make the person whole. And they last anywhere from 7 to 40 years, depending on how hard the person is on them and the materials that were used. But as you can see, there's a lot of gray in there with, whether a tooth lasts for a certain amount of years or almost a lifetime. I mean, I can say with the dentistry I've done, and I'd like to think of myself as a good dentist, none of my dentistry will last a lifetime. It'll have to be replaced at some point in their life. The materials just don't last forever. And that's pretty much almost anything medical. So that's what we have to look at. And of course, that extends into bigger items like bridges. Some of you may even know what these are. It's where a tooth has been lost and maybe they're not the best candidate for an implant. So we use the adjacent teeth to be able to use a bridge. And I'm not going to bore you with all these dental terms, but I just want to give you a kind of a quick study on a crash course, dentistry for dummies, so to speak, in the sense that just giving you an idea of kind of what we have to deal with as dentists to be able to get these patients whole again. And then, of course, people probably are somewhat familiar with implants. Implants are a wonderful way to be able to replace missing teeth, either one or multiple missing teeth, to be able to make them whole again. And we've gotten to the point now where we can make them feel and look like you never lost the tooth. That you can't quite say the same thing about a prosthetic arm. Yeah, Blue?
Hey, Trey, we got a question here real quick.
Yeah.
Edward Graham says he has a client with a permanent injury to the maxillary branch of the trigeminal nerve following placement of knee implants. What is the most probable mechanism of injury? Also, he's having difficulty finding a standard of care expert with specific knowledge and experience with said implants.
So to get back to that, what that basically means is that the patient has a kind of chronic pain with a nerve that sounds like from what you said, the implant tapped into the nerve, and that's difficult because the upper maxilla has 3 very large nerves, and when you place implants, sometimes you can come dangerously close to a nerve. So it sounds like it's a malpractice case, from what I can tell, not necessarily a person.
And he says he needs someone who can address whether the defendant dentist properly performed placement of mini implants. And he asks if you have any recommendations for such expert.
Yeah, I do that. That's what I do. I'll recommend myself. Yeah, that's the type of thing I can actually help with because I place implants, quite a few implants, several thousand I've placed over the years too. So implant placement normally goes without major issue, but there are some key nerves in the three big ones in the upper, one big one on the lower, and you have to really be very careful with where those nerves are so that you place implants. It does happen, and of course it comes down to consent forms and whether they were properly informed before you began the surgery. And these, I've never personally, knock on wood, ever had it happen to me in any of my placements of implants, but there could be some negligence there, or maybe not. Just unfortunately a combination of a complication that occurred as a result of surgeries. We see this in medical issues all the time. But yeah, I'd be happy to be able to look at this if you had interest down the road too. But that's a wonderful, great question, and very specific. I like that. That is like to the point of the knife. Yes.
Perfect. And then and feel free to reach out to Doc Trent directly afterwards. He'll leave all of his information. Gregory Brown asks, for dentists retained as experts and or providing opinions as parties treating dentists, do you offer an independent cost analysis for future treatment?
I do. Yes, absolutely. I will, depending on the situation, I do offer that, because as I've kind of mentioned today, we do have to look at today and tomorrow. So anything associated with any kind of personal injury, or just these are, you got to remember, it's not just personal injury. I also do patients that maybe have neglected their mouth over the years and want to know kind of a lifetime strategy of getting them back to normal again. So we have to look at and amortize those type of things too. So absolutely, I do provide that also.
So also for a single tooth, using a crown example, is the figure informed by age, life expectancy, and how many times a crown will have to be replaced? Does the future replacement figure typically include related or associated costs like a temporary crown, lab fees, etc.?
It does, and all the figures that you'll see today, because I have a few more to show you, will include kind of everything. I don't want to piecemeal it, because that's also very specific. I'm very proud of the level of these questions. These are great questions. They're with anybody that has not had a crown, those of you that have had them probably can relate to what I'm talking about. Is that with a crown, you'll typically have a temporary phase where you have a temporary crown in there that will hold the position for the future crown that's more of a permanent basis, because that's to be lab fabricated. And these days they're CAD fabricated, machine fabricated, or human made still. It just depends on kind of what laboratory you use, but they all take several weeks to several months to make and fabricate. And yes, this would include everything within, of course, but every case is different. I mean, every situation where some patients may need just a single tooth. Some people may need to have an entire arch done, like all of their upper teeth, in a temporary phase for the next few months until the implants mature. So not to sound ambiguous, but there are so many different facets, but yes, there's always a remedy for everyone. We always can find a way around, and usually multiple options to be able to.
And Trent, I have two more questions here, and then we're going to go to our wonderful sponsors. Okay. Back to Edward's question, he says it was regarding mini implants.
Okay. Yeah, so I would just need to see kind of specifically what where maybe the breach was, or where the implants ended. That just takes X-rays, the notes, and full records to be able to evaluate those specific things. Yeah.
Perfect. All right, and last question is from Paul Jacobs. Do you recommend a gold crown over all other composites for durability, or would you recommend a lesser durability material, assuming the tooth is visible when smiling?
You guys are killing me on the level of these questions. These are really great questions. This is a group of attorneys. You guys sound like your doctors. My doctors don't even ask these kind of questions. I'm proud of you. Great question. So gold is still the gold standard with regard to how we look at restoring teeth. The problem is that nobody wants a full grill of gold. You know, I mean, there's some people that want that, but for the most part, most people don't want that. So it does last the longest, but it is not always the most aesthetic. So we have aesthetic options, but they typically don't last as long, ironically. So we haven't quite evolved in dentistry to the point where our all ceramic, like what you see actually in these pictures right here, are all ceramic over a metal platform of an implant. But these will not last as long as gold. Gold will last you a lifetime. It just is whether the tooth will last a lifetime. So we have to look at both the tooth and the restoration on the teeth. That's a great question.
All right, Trent, I'm going to throw one more at you because we have a little bit of time here, and then we'll get to our sponsors. Susie Pedipus asks, we have a client who clearly injured herself falling on her face. However, she did not mention it to her dentist. How do we tie in the causation to the fall 3 years later? And can a dentist tell that the damage was caused by trauma if the patient did not mention it to him when she went to see him?
Well, okay, so yeah, 3 years, that's difficult because typically if somebody falls on their face, there is an immediate effect of that, meaning like I've showed a couple of pictures today where you'll see two front teeth that are broken and they're very motivated to get to their dentist or a dentist and say, what can you do to fix my situation?
So are they able to tie that causation 3 years later to the accident?
Yeah, like anything, the more time that goes by, the less chance of your position, obviously, and unless it was done yesterday, then you have immediate records to signify. It does depend on the case and it depends on the x-rays that were taken and when. Sometimes some of the best way to prove things and causation will be, what did this x-ray look like? Because if x-rays exist before the trauma and after the trauma. So for example, if this woman did have some trauma to her teeth, but she had been to her dentist 2 months before for a cleaning, and everything and x-rays were taken and everything looked normal, and now 3 years later, she hasn't been for 3 years, new x-rays were taken and all these fractured areas occur, and you can tie that to no other trauma that occurred. She's not been in any other car accidents, she hasn't been any kind of trauma issues other than she can attribute to when she fell that day. There is some connectability, but as attorneys, you probably know there's a lot of holes you can poke in that one, because they're going to say, well, it was 3 years ago. If it was so bad, why didn't you go then? And maybe they didn't know, but it depends on the complexity of the injuries.
Got it. Got it.
Yeah.
Okay, Ginger, is this a good time to bring in our sponsors?
It sure is. Thank you so much, Blue. And by the way, I've really been enjoying these questions too.
Yeah,
So
very good.
please keep asking them. I know that we have more that's coming in as well, so we will definitely get to those. But right now, I'm going to introduce briefly, and Dr. Smallwood, is it okay I close out of your slides just for a minute?
Oh, yeah,
And
absolutely.
I am bringing in Patrick with On Point Legal Nurse Consulting. And Patrick's been a nurse, you guys, for like over 20 years. And they have a fabulous team. You've probably heard John Romano. He raves about working with them. He raves about the pain and suffering reports that they do. Patrick's going to go into a list of all the things that they offer. But Patrick was just with us speaking in Nashville. And by the way, that was an incredible seminar. So thank you for everybody asking about that. Our next one's coming up in Texas. It's going to be at the Stockyards. It's going to be Satch Oliver, John Romano, and a couple others. They're going to be talking about depositions, our trial, and it's our second annual conference for that. So more details are on the website. But for now, Patrick is here with us, and we are so glad to have you with us. Patrick, if you have anything you'd like to talk about with On Point, we'd love to hear it.
Sure. No, thank you for having me again. Nice to see you, Blue. Nice to meet you, Doctor.
Hi there.
My name's Patrick Stonich. I'm one of the directors over at On Point, legal nurse consultant and expert witness placement. Like Ginger said, just 20 years, so not more than 20. So I'm getting right there at that point. But my background was in originally at Thomas Jefferson University in Philadelphia in cardiac ICU care. And then I left the hospital and went out into the crazy world of community health, which is home health, hospice, and all the long-term care stuff. So skilled nursing facilities, group homes, assisted living facilities, anything post-acute was my background. So instead, normally I just talk and tell you the list of what we do, but I thought I could share and how this will work. If you can see my screen, this is what kind of our process over at On Point. So what we do, many things that we do, but this is one of the comprehensive reports that we start. And actually it's perfect because of what Dr. Smallwood was talking about. Through this whole process this is actually one of the cases that I'm working on. We identified in there that they actually need a dentist expert because they did lose their two central incisors when she was hit by a car in Washington, D.C. This was an individual 33-year-old female. She was crossing the street with her friend, and there was a high-speed chase through DC by the Secret Service. And they this woman, one of them died on arrival, and the other ended up in the emergency room with 9 months of ICU rehab, everything. it's a miracle that she survived. But I wanted to show you kind of the process that we go through, or I go through when we get this. So of course we get the initial records that come over. This was 27,500 pages of records. So we're all used to seeing, you know, the tons and tons and tons of progress notes that happen. What happens next is we take all of that information and we create a chronology. So we have your date, of course, your source, where it happened, page numbers if we can, if it's not bait stamped, and then we source kind of what the document is. So we label them generic, so you can filter it out later, and you'll always get the source Excel spreadsheet, and then of course a beautiful report afterwards. But we want to make it easy. So if you want to come in here and you can source out, I only want to see incidents, lab results, medications, procedures, and so on. We color code it for the event. Red is a huge red flag, so obviously something major happened, and then yellow is just a little bit less, but still quite important. So we go through, this is just major, it's not a day-to-day you know, chronology of what happened. These are just the major events that actually happened. From there, it gets put into this long analysis. So we start any surgical procedures. We go through post-accident, new diagnoses, pre-diagnosis, and exactly kind of what happened. From this, the next screen, this is kind of the final product. So all the records that were reviewed, the whole medical history, social history, all the surgical history that is involved, and the nurse, which is me, do the overview and analysis of everything that happened. Anything that's in bold is something that really needs to stand out to the attorney to make sure that's something we focus on. Any abnormal diagnostic testing, and then of course the strengths and weaknesses of the case. Any alerts and inconsistencies. This one, there was a lot of notes that were signed a month later, which is a huge red flag in the medical world, because you're supposed to complete your note when you complete your note and you do your assessment. It's not supposed to happen, you know, 2 months later after an injury. And the notes that were changed, because we did pull the metadata from Epic, and we saw that they're actually changing information that was not supposed to be changed. The cool part about doing these whole chronologies is that we're identifying who you possibly might need as experts as we go along. So as I'm reviewing this case, I see that we need a dentist. I immediately reach out to Dr. Smallwood and say, we have this case and here you go. The last thing we put in there is I basically copy and paste over. So this is a whole thing that goes into one kind of full document for review. We always share everything that we do. If you want to, I mean, if you would like to share all the notes, we share them back and forth. I highlight my notes in Adobe and it's easy to share. Some people want to see them, some people don't want to see them, or they don't want it to be discovered at a later point. But so this is a full comprehensive chronology that happens from, you know, from the start that we get all of these records. When records come in later, we add it back to the report. And what we'll do is we'll highlight or put an asterisk that these are new records, these are new reports, and then move on. So they can be lengthy, 27,000 pages to review. They're hospital records, so they tend to repeat a lot of the same information, but you still have to go through all of them. So it's very helpful. It's kind of a roadmap of what happened to the patients or the client. It's nice to be able to reference back. It's great for trial prep and deposition prep. You have everything right in front of you. Some people ask us to do hyperlinks, which we can certainly do. Some people don't want to do the hyperlinks, but that's up to you guys. Other things that we do over at OnPoint, we do the pain and suffering reports, which is what I talked about in Nashville. It's a great report. It's a comprehensive non-economic damages report. And then, of course, all of our wonderful experts. We have a great database of about 2,000 experts, both nursing and on the medical side, that can assist of doing those expert reports.
That is awesome, Patrick. And I loved how you showed that kind of visual for everybody. If anyone watching would like to see more of that, or just they're curious about it, want to ask questions, please reach out to Patrick. And like I said, their company does a lot more, I mean, great things. So he's going to put his information in the chat box for you. And Patrick, it is always an honor having you with us as well.
Thank you very much. And the answer is always gold grill for Dr. Smallwood, a full grill.
What'd you say? What'd you say?
I'm looking for a full gold grill for nursing.
Oh, right. Yeah, I know. I
It's a
have
good look.
to tread lightly with that one. Yeah, I get you.
And also, real quick, June 19th, I
Yes.
believe, is
Yeah.
OnPoint's. They're doing a wonderful conference out there. If you're going to be in Philadelphia, is there anything you want to add to that real quick, Patrick?
We're getting ready for it. So we have a group of great speakers. Jessica Latour from Romano Group is coming up to speak. We have Victoria Shaw from New Jersey is going to be speaking about nursing home neglect and abuse. We have a wonderful attorney, Sue Nolan, from the Senior Law Center in Philadelphia that's talking about financial fraud and exploitation. Then, of course, I'm going to be talking about home health and hospice and those cases that we see. Ingrid, who's amazing, she's going to be talking about skilled nursing facility and utilizing the new data that's out there about the star rating system, and most importantly, finding out who actually really owns these skilled nursing facilities, which is eye-opening of all the information you can now find on Medicare's site. So it's going to be a great day. It's at the Barnes Foundation, which is a beautiful museum. We have the whole museum to ourselves, and it should be a fun day. So thank you for promoting it.
And I'll send a link out to everybody after the webinar too, but thanks for being with us today, Patrick.
Please, thank you.
And now I wanted to introduce real quick Jonathan with Emotion Track. This is an incredible company we've been working with for a while now. John Romano has some cases with them, and I can't wait because I'm hearing about all the results that are coming through. But they are doing really cool stuff. I'm gonna let Jonathan tell you a little bit about it real fast. And Jonathan, it's great to have you with us today.
You're the best cheerleader, Ginger, so I appreciate it. All right, let me share my screen here. I'm just going to walk you guys through just a real high level overview, and then I'm going to let you watch a fun video. But listen, we're in the business, very simple, really, with what we do. We want to help you maximize outcomes, whether you're going to mediation or you're going to a jury trial. It's that simple. And this is kind of the through line through our product. Decisions are based on emotions and feelings, right? Most communication is nonverbal. And so we give you the ability to sort of peek into somebody's mind and to help you understand how your case story is going to resonate, right? Which is really everything if you're a trial attorney. And this is how we do it. So the software is designed to pick up what's called micro facial expressions. And our software model that we've developed translates those micro expressions into a corresponding emotion. So you can see moment by moment how your story is going to resonate with a panel. And then we give you the ability to query and ask questions to the 100 panelists. So you get that qualitative piece. It's all digital through our platform. You don't have to invite people to a room. You don't have to feed them. You don't get any of the logistics. We take care of all that. We write a full report, we deliver it to you, and we do a full debrief telling you how the story resonated. And this is kind of the fun thing. This is a recent client, so I'm just going to play this because I think he does a good job telling the story of a case we helped him with. It's really interesting, so I'm going to play this for you.
Hey everyone, Steve Benedetto of the People's Law Firm and Policy Limit Demands here, making a quick video to share my experience with Emotion Track, a company that I just worked with for the first time, and I couldn't be more excited about this product, this company, and what they're able to do to help me with one of my more important cases. This is a case that my firm brought in about 4 months ago. The client was previously represented by a large national law firm, a billboard advertising firm, that had not done much on her case and had only secured a $25,000 offer. We took it over, realized this was a case that needed more attention, did a significant investigation, found a lot of problems with the other driver. Only problem with this case, which involved our client being injured in the back of a rideshare company's vehicle, the only problem was that there was questions about fault, whether the rideshare driver was at fault or whether the party at fault was the driver that T-boned them. As a result, the pre-litigation offer was being driven down by that. The insurance adjuster for the rideshare company was really swayed by the idea that the other driver was at fault, was not offering much. So we, like I said, did a lot of investigation and presented the results of our investigation in an Emotion Track focus group. The feedback we got was invaluable. It was so helpful on the issue of liability and damages in particular that we shared it with the insurance company with our multimedia demand package. And the end result was a settlement that was very close to the $1 million policy limits. So I don't know what the math is on that, something like 30, 35, 40x what the original offer was, but the outcome was fantastic. Aaron and his team at Emotion Track were super helpful, really easy to work with, incredibly responsive, and fast tracked our case, knowing our timeline. I will definitely work with them again and would encourage you on any case that you are thinking about taking to trial, or a case in which you have a significant issue pre-litigation that you would like to help educate an adjuster on. Would strongly encourage you to use Emotion Track. This is a really powerful product that I can't wait to use again. So wish you all the best of luck. And if you have any questions about my experience, don't hesitate to reach out. Happy to share it.
All right. I know that was kind of shameless, but
No, but I love hearing testimonials from other attorneys. And you guys are working with a lot of great people that I know, like Keith Mitnick, Ilya Lerma, Dino Colombo, and they're getting incredible verdicts. So this is a very, very specialized, it's like work that you guys do. And I think people definitely need to take lead in learning more about it. So reach out to Jonathan, you guys, if you get a chance. He's going to put his information in the chat box, and maybe just check out their website because they've got some neat things on there.
that would be great. Thank you, Ginger. Appreciate it.
All right, Jonathan, we'll see you back here again tomorrow, okay?
You bet.
All right. Bleu and Dr. Smallwood, back to you.
Awesome. Thank you, Ginger. And thank you to all of our wonderful sponsors and friends of mine. So that was great. Before we jump back in, Dr. Smallwood, there is one more question that popped up. It is from Lakeisha Fair. She says, my 94-year-old client swallowed putty while she was getting fitted for dentures and had to get emergency surgery. The putty was surgically removed from her stomach to a tune of $35K. Any recommendations for standard of care expert? Do you handle them?
Yes, I do handle them. That one's a hard one because of the fact that putty is basically it's impression material that's used to replicate whatever is in the mouth so that they can pour it up in stone and create a denture or create a crown or whatever it might be. It is something that happens on occasion, and it's not a real big deal if they swallow it and it goes down to the stomach and then they just pass it like normal. The issue is whether they were on their kind of more on their back and they aspirated it, which means it can go into their lungs. That's probably what happened, because at $35,000 for treatment, I would imagine they had to probably remove it from her lung, and there's a difference between that and the stomach. Not that it matters the specifics, but is it negligence? I mean, it's part of the risk in dentistry, and again, like many of you know, as attorneys, the consent form is the most important part of all of this. Is that they should have signed a consent form saying that that is a possibility. It could happen. We see this in surgeries where something maybe was left in the body, that shouldn't have been. That would be negligence, but things can happen, complications can occur, and it's like nobody expects for there to have that goopy stuff going into the back of their throat and they swallow it. But at that age, they tend to be a little bit erratic patients. So it again, without looking at the specifics, it's a possibility that there was negligence. There would just need to be to see how it was documented. If they documented it within the notes and said she did, in fact, swallow this and aspirate it, then she would need surgery. If they don't document it and she had this done, that would be a very bad thing, because if they document that something happened, at least they're acknowledging that there was an existence of the issue. Was it necessarily negligence or not? I'm not sure right now at this point, but it's happened. I've had it happen before. I've never had somebody have to have surgery. They never aspirated it. But we will sometimes have to send them to get an x-ray to see if we can see where it is. And again, if it's up higher, it's in the lung. If it's lower, it's in the stomach. And if it's in the stomach, it usually just passes. It's not that big a deal. So an x-ray would tell us where it occurred. That was the very long-winded version of the answer. Sorry about that.
No, these are excellent. They're really testing you today.
Yeah, they are. They're great. Great questions. I love them.
That's awesome. Okay, jump back in.
Okay, so to kind of continue on the same vein on this is, for example, a lot of pulpal pains, where you can see kind of from the pictures here. This is where people will come down hard on teeth, much like I think you had mentioned, Bleu, a question earlier about somebody falling on their face. This is where not just fractures can occur, but more internal type of damages that maybe, for example, she said 3 years later, there could be something more going on with the patient or the person that fell on her face, is now she's seeing a sequela of that accident in multiple teeth needing root canals when she's never had a history of root canals. You could potentially trace that back to the fact that it was the accident where she fell that caused that. So pulpal pain, and that can be costly too, because pulpal pain, those of you that have experienced this personally, can be not necessarily from trauma. It can be from cavities. It can be from thermal issues, like you had coffee that was too hot or ice cream that was too cold. That can lead to the loss of a nerve, which would lead to a root canal. That's more of a common name for it that many of you may associate with. And those then can factor into a lot of loss over time, because a root canal may need to be retreated a couple of times in a lifetime, depending on when it occurred, whether it occurred at 18 or whether it occurred at 88. There's a difference, obviously, in the amount of life that's left in that person. So you have to kind of amortize that. So they obviously can be not just fractures. It's the obvious thing that we see are the fractures, the broken teeth. But then there can be deeper issues where, for example, a broken jaw can occur. And this can be where they have nerve damage. And they have what they call paresthesia, where they don't feel the lower half of their jaw because their very large mandibular nerve has been severed or partially severed. And though of the body, the nerves are one of the few things that can regenerate. They don't, if it's cut, they won't regenerate. But if it's partially cut, you can regain sometimes feeling back. So it's difficult. But if you don't, then you have this chronic pain where it was severed and it just will never go away. And it's hard to treat with medication or therapy. And that kind of goes into the quality of life. That person will suffer for a lifetime, at least on some level. And that's very difficult. And that can occur from jaw pain, among other types of fractures and pain also. So that's a big one, because you look at the quality of life, that happens to be a very large one. TMJ issues. Some of you may already experience temporomandibular joint dysfunction of some sort, or we call it TMJ malalignment issues, where your jaw doesn't quite come together. That usually comes from oftentimes trauma, clenching, grinding. There's a lot of other things that can cause this as well. But if somebody was in a traumatic accident and their teeth just aren't coming together the same way, that usually means they've had a temporomandibular joint issue. A temporomandibular joint, or a TMJ, is much like a knee. It's a very complex unit, or a hip, or a shoulder. They're all very complex elements to basically help you rotate your arms, your legs, but in this case, your jaws. And if one or both of your sides of your jaw is affected, it can affect potentially your life forever. And many of you probably have been dealt with certain cases where the person's mouth had to be wired shut. That was from a fracture of the jaw, or it was from an accident that caused or affected the TMJ joint. So these are all, again, big items that can really be very costly for the patient. And then the suffering that the patient can occur can be significant over a lifetime also. And it's not as big of a deal to treat it, but then they have to kind of deal with it for the rest of their lives. So TMD issues can be fixed, they can be remedied, or they can be lessened. But they are a significant thing. And some of you probably suffer from this, at least from a small point, from clenching or grinding, often brought on by stress, if not trauma. It can be very frustrating for patients, just kind of the quality of life.
Hey, Trent, real quick.
Shoot.
This is an interesting question. I'm interested to hear what you had to say about this. Rita Norton asks, years ago, I broke 2 teeth in the rear after eating a piece of Mrs. Smith's cherry pie. What could I have done legally at the time? How could I have proved that my teeth broke due to the company's cherry pie?
Great question. So I get this probably a dozen times a year, where somebody will come in with something. For a long time, it was the Olive Garden, because they didn't take the pits out of their well enough. They didn't take them out of their some of their salads, the olive pits, and people would come down, bite down hard, because you're just biting, not assuming that whatever you're eating, like salad, is going to be relatively soft. And when you're going and biting hard and something is introduced, like something hard that's harder than the teeth, and you come down hard on it, we probably have all done that to some degree over a lifetime. it can have jarring effects. Most often we're okay, but many times it will break a tooth, and it can break a tooth right in half. The tooth may have to be removed. What we typically see is an immediate call, unlike the question you had earlier, Blue, where you said the person didn't, mention anything for 3 years, and do I still have a potential case 3 years later? That's, of course you do, but there is obviously, as time passes, you have less of a position that you can attribute that trauma to. But people will typically say, I was at Olive Garden this morning, and not to single out Olive Garden, I've not seen anything come from them in a long time. I think they made some big drastic changes for that, but that was one I did see for a long time. And they came back, they'd say that the tooth broke, they'd have part of the tooth and potentially the pit that actually caused the break. The problem is you don't always have the evidence that caused the fracture in food, whatever it might be. And if you don't, that can hurt you. But if you do, then a dentist and an astute dentist can look at those and go, there is definitely a cause and effect of a result of what was in the food. And then, of course, x-rays would be taken, records would be taken. When Patrick had mentioned the 27,000 data sheets that he had mentioned, I've seen a couple of thousand before, but I've never seen anything that I can't even imagine that would be. But there's always going to be, obviously, records that were taken that would potentially prove that, or at least attribute to the fact that this fractured tooth occurred based on something they ate. And if they're negligent by having something they shouldn't be in that cookie or that salad or whatever it might be, then the key is timing. You just don't want to wait 3 years. You want to try to get that addressed right away, or at least evaluated. And sometimes they come in. I had a woman that was in a car accident, and well, let me just finish this one thought. She was in a car accident. I evaluated all of her teeth, and she really just wanted her teeth all redone. And I just couldn't attribute any of her issues, which were none, to the car accident. And that was one of those things where it was difficult because she just really didn't have a case, but she was trying to build a case through the dental side of it. Yes, go ahead, Blue.
So you have a very engaging audience here today, Trent. Let me get this one more question out to you. And this one has to do with psychological injuries. So Paul Jacobs asked, individuals may not have any direct dental or even oral injury from traumatic accident or event, but have a psychological injury and have PTSD as a result of the experience. In your experience, have you seen patients who have no initial dental trauma, but who develop bruxism, including nocturnal bruxism, after a traumatic event, causing long-term and emotional distress, such as PTSD?
God, another great question, man. That goes into a whole nother level. So basically, to summarize what's asked there is maybe there was no direct issue with the teeth, but the trauma of the accident, whatever it might be, has caused bruxism. And just to let you know, bruxism is an extreme grinding of the teeth. And usually we'll see bruxism is a movement of the teeth over teeth. So as imagine two stones rubbed over time, they'll eventually kind of wear each other flat if they're comparable stones. The same kind of thing happens with teeth. Clenching is the opposite of that, where people will just bite and hold. And those can also be a factor because over time they will start to split and break teeth. People sometimes will even have a combination of both. The problem that you have in this case, to answer the question, is the tie-in to the accident. So I would think that a psychologist as well as a dentist would probably be able to say, yes, there is a certain possibility that the damage of these teeth for the 28 years that I've known this patient has been really almost unremarkable. And then the moment after the accident, for the next 3 years, this guy had nothing but trouble with his teeth. You might be able to tie it in to the fact that the trauma has caused a PTSD, if you will, that has caused now a kind of secondary effect of his teeth. That's an immediate degradation of his teeth as a result of the psychological trauma that he's having that will manifest on teeth. And many of you probably have felt this personally in a smaller level. If you've had some sort of traumatic event or an emotional event or a divorce or a breaking up with your girlfriend or whatever it might be, you may notice that or stress at work, you have clenching and grinding that occurs because of that. So on a more macro level, with a trauma, like a major trauma event that you guys will deal with, oftentimes that can absolutely manifest it's just hard to measure because you need years. It won't happen in a day. It's minimum of months, if not years, to see something actually manifest from it, Bleu. So that's where your difficulty is. It's a very gray area, but it could certainly be attached to the rest of the case as a possibility. Absolutely.
Understood.
Great
Thank you
question.
so much for answering that.
Yep. So as I'm kind of finishing out, we deal with a lot of different types of elements that deal where facial trauma from the side can bow smiles in, and sometimes they have this pre-existing, sometimes as a result of trauma. All of these can be affected, but our ultimate goal is to get them into a whole, happy kind of place. This is what an ideal arch is. Of course, these are the things that get me so excited. To you guys, you're like, oh my God, they're freaking teeth, you know, whatever. But this is the harmony that I try to get everybody to, and they usually, once you do, they are harmonious, and the effects of the trauma have been now in fact reversed to a degree, and the patient's happy. But these effects of these trauma can lead to digestion issues if they're missing back teeth because of the fractures, or front teeth. Self-esteem, which we kind of talked about a little bit today. Of course, pain on many different levels, whether it's tooth pain, nerve pain, or jaw pain, or TM joint pain. All of this can be affected. And of course, the loss of work. There's a number attached to all of these. The hard part is establishing what that number is. That's I'm so glad I don't have to really worry about that as much. But patient, for example, just to give you an idea of the type of things that we can do from the restorative standpoint, we have a patient that lost multiple back teeth, and as a result, too, had a clenching and grinding problem, very similar to a degree off of the question that was asked earlier. And as a result, was getting a tremendous loss of the gum and the bone kind of between her front teeth, you can see here. And we were able to then to just simply move her teeth, recontour her teeth, and get her stabilized again. And she no longer was clenching and grinding as a result of the accident that she had. So this is similar to what you had. She had some of this pre-existing also, but the accident kind of exacerbated the whole situation for her. And it went from a kind of a 4 on the stress level to a 10. And we were able to stabilize her with just simply movement of teeth and contouring of teeth. And believe it or not, there is no restorative element here. It's just simply me contouring the teeth, it's resetting her bite, and then moving her teeth into a more ideal functional type of place. And then this patient basically was also in a traumatic situation where she broke the back of several of her back, the inside of some of her back teeth and her canine and premolars. And so we had to end up restoring her, and I was able to put her in a position to where we were able to minimally invasively be able to correct her smile and give her, of course, at the same time, while I'm at it, I'm going to give her a beautiful smile. And all of her pain went away. She did have to have a few root canals as a result of her accident, but she was all put back together and made whole, so to speak. So it really comes down to the understanding of smiles, to getting the correct nuances of a smile. As Bleu kind of mentioned, I've published a lot of articles on the subject of functional and aesthetic smiles. That's kind of my forte. And as he had mentioned too, I do a lot of expert witness work on whether I'm evaluating cases that have been done, was their negligence on both sides of the aisle, if you will, with regard to defense and plaintiff sides of it. And I've written two manuals on this topic on functional and aesthetic dentistry to get patients back to normal, what it takes to get them to ideal again. And of course, my goal is to get them as close to ideal or normal as I can. I can't always get them where I want to, but I get them really close most of the time. And that's the thing about medicine, is they call it a practice, and that's exactly what it is. It gets us very close. And sometimes we hit a home run and we get them completely back to normal. But it is amazing. I mean, when you look at certain teeth and shapes, even the type and shape of teeth can be more feminine or more masculine. I mean, we get so specific with how we are able to restore these cases. It's really a lot of fun for me, and I enjoy getting these patients back to normal, especially in the sense of the pain and suffering they've kind of been through. So that said, finishing with this last case, this was a patient that congenitally was missing some very, very back teeth, but she also in an accident had lost her lateral incisors. So we moved her canines into the lateral position and we were able to make her look nice and normal again. Instead of, she's actually 27 years old. She looks like she's 12, but now she actually looks like a woman commensurate of her age. So that's what I do. That's what excites me. I love dentistry. It's been a wonderful thing for me for 30 years. And I know what it takes to get a patient back to normal. And I also know how to evaluate cases that have been done correctly or incorrectly to be able to get a patient back to normal. But that's, yeah.
Trent, to that point, last question of the day, and I think this fits in perfectly to what you're speaking on right now.
Yeah.
Gregory Bell says, when you offer expert opinions, whether it be as to future care needs and or standard of care, etc., in addition to your education and training, clinical practice experience, are there applicable accepted dental guidelines or literature for these subjects that typically provide additional support for these subjects? Also, when opining about future care costs, is it common to distinguish between clear-cut medically necessary items, procedures, and services that a person undoubtedly needs, and two, recommended services that aren't necessary, medically critical, but would help the affected person's life quite a bit?
Well, I think there's like 6 questions in that one. So
There
the short
is.
answer is yes to the first part, which I've now forgotten. I just remember saying to myself that's yes on the first half of that. What was that one, Bleu?
Applicable accepted dental guidelines or literature for these subjects.
There is support on everything out there. To kind of go and meld the last 2 or 3 questions that are in there. Obviously, if somebody breaks the 2 front teeth, where we have to look clinically and legally probably is that the accident that caused this person to lose their front teeth, they were whole yesterday and today they are not. Do we just put, for example, 2 implants or 2 crowns on those 2 front teeth? Will that suffice? Or do they need to now have multiple teeth restored to make them look acceptable? Some of you that have ever had a single tooth in the front ever replaced will know that it's never quite the same as the teeth that are natural. So the argument is, well, now the guy has to have 2 implants, the victim in all of this has to have 2 implants on the 2 front teeth. But to make everything blend nicely, we really should do the next 2 or 4 teeth also, not implants necessarily, but putting veneers on them so that everything looks normal, because they could now have a self-esteem issue because they lost the 2 front teeth and they went to a dentist maybe that didn't do the best job. And now they have PTSD, going back to your earlier question, because they're upset because now, because of the accident, nothing looks right up there. So how many teeth is enough? Of course, that's a very gray area, but it's very arguable. To make the person whole, even though only 2 teeth were affected, you may need to include 4, 6, or 8 teeth to be able to really make everything invisible, if that makes sense. Again, I'm not a medical doctor, but if a hip was damaged in an accident and the left one was partially damaged, but they don't need a replacement, they may opt to just do new hips on both sides with the same prosthetic to make everything even. That would be, is it usual and customary? Is it normal? Is it necessary to replace both, even though one's broken and fractured, but the other one could get by? You've got to make that call. And of course, as you know, that just comes down to the settlement and the discussion as you progress through the case, or if eventually litigation would determine what those damages would be, that's where it has to be determined. So yes, we can look beyond the absolute teeth affected by all of this. Sometimes we need to look beyond and see if there's more teeth affected. And the other part, like I said, is residual. Like, what if in 3 years they end up having 4 root canals on the lower teeth that nobody noticed on the front end of it, but 3 years later it manifests into a significant issue? Great question.
Wonderful, wonderful. So I think now is a great time to meet our wonderful friends over at FAACD. The technology that they're doing over there is just unbelievable. If you haven't seen it, everyone, you are in for an absolute treat. And Ginger, if you want to bring in, I believe it's Nathaniel with FAACD today.
Absolutely. Nathaniel is here. He's subbing in for Cody today, but we are thrilled to have him because he's going to share with you guys some of the great things that they do. And if you happen to be available tomorrow for our next webinar that we're doing at 3 o'clock Eastern time, it is actually the beginning of our motorcycle crash series that John Romano has masterminded. And Cody will be one of the speakers on this webinar that we're doing, in addition with Todd Romano, who's John's son. But Cody is going to be sharing some really cool videos and animations. But Nathaniel, sorry, I don't want to take it all away. I'll let you speak for yourself and tell us a little bit more about what you guys do.
Yeah, no worries. And it looks like someone's still sharing their screen.
So
So
sorry.
Here
That's
we go.
my fault. Go
no
ahead.
problem.
Thanks, Dr.
Yeah.
Smallwood.
So
Yeah.
so good to be here once again. Good to see you, Ginger, and good to meet you, Dr. Smallwood.
Hi there.
Hey. And so I'm a mechanical engineer. I work here at FAACD, and we do pretty much any type of graphics you can think of. We do medical, we do accident recon, we do just PowerPoint organization and make it look pretty and awesome. So today I've got an animation to show you guys, which is an oral misdiagnosis of cancer that resulted in a huge surgery that if it was diagnosed earlier, it would have been caught and a minimally invasive surgery would have happened. So here you're thinking, what's this going on here? Because I thought it was an oral cancer thing. This is actually, it was such a bad diagnosis, the cancer had spread, as you'll see here, right here, that the whole front part of the upper jaw had to be removed and replaced with part of the bone in the client's leg. And so there's a huge incision that ran up from her top of her lip all the way up to her cheekbone. And they had to remove, like I said, the whole top section of this poor client's jaw. And they used all these different tools. And you'll see here in just a minute, they basically used a chisel to finish cutting that part out. And they had to basically extract all the upper teeth except the 2 back molars. And of course, there's the actual photo blurred out for queasiness purposes. But here it comes in the leg bone portion, and all these different little tiny plates and screws and rods. And then finally, that's the end of that surgery. But we also like to take what would have happened if it would have been caught and diagnosed earlier, would have been that little tiny spot of cancer shown right there. And only 3 teeth would have had to been removed, and a portion of her upper jaw would have only had to been removed. And she wouldn't have that huge scar line from that massive incision. And they would have been able to just on the same day insert that implant, and she would have been able to not have as much of a major surgery or pain and suffering.
So, Nathaniel, we were trying to keep it easy for everybody who might be having lunch today, but those graphics are so realistic. In fact, I was talking to Dr. Smallwood. He was being very kind with everybody when he was showing these pictures and images, but that was, whoa. What you guys are doing over there is just incredible, how you're able to talk to the attorneys and other experts and then create all of this to share with the juries. I mean, it's pretty amazing. But well, a little too realistic for us. It's good. But keep up the great work. I mean, you guys are amazing at what you're doing. And I know you're going to put your information in the chat box, but I hope everybody watching definitely saves your information, because at some point they're going to want to ask you some questions or maybe work with you guys in the future. So great job. We love having you here with us.
Yep, same here. Thank you.
And Dr. Smallwood, I guess you kind of get what they're doing when you see that,
Yeah.
don't you?
I do. Oh yeah, that's a very fascinating element, and it's funny because to restore and replace a lot of maxillary issues like this one or mandibular, they use a lot of parts of the body, usually below the waist, to be able to restore and replace those. Then he didn't get into that, but the next part of that is the person will end up having probably an overdenture or implants that will be placed in there, depending on how well the bone integrates. And it's a very painful, invasive surgery, but and it just I feel for them, because I resonate with what he said too about how if they had found it early, it would have been a very small thing to fix, relatively small, compared to the very invasive option that ended up occurring. That's just hard to see.
Yeah, absolutely.
Yeah.
But I tell you what, I can't thank you enough, everybody, for being here today and for watching this. I'm already thinking of ideas, Dr. Smallwood, of other webinars that we could do.
Yeah.
If anyone has any last minute questions, ask them now before we head out for the day. But otherwise, I want you to stay in touch with Dr. Smallwood. And Dr. Smallwood, if someone has any questions about follow-up, or if they want to reach you, or if they want a copy of the slides, should they reach out to you directly for that?
Absolutely. And then I just put in the chat, I just put my email address. If anybody needs any help or evaluating, that came up with a couple of people in questions today. If they need kind of another set of eyes or an expert opinion on some of these positions, and do we have a case? Do we not? What are your thoughts on it? I'm always happy to help. I have a lot of background in that area, and I'm fast and I'm efficient. I get it done quickly. I don't dink around. So you'll be happy with my results. I'm happy to help anyone.
Oh, that is fantastic. And I love how Bleu and Nathaniel, thank you again so much for being with us. We're going to see you back here, I hope, very soon. And hopefully you'll be on the webinar with us tomorrow. And before we hop off, I also want to have Bleu just share a little bit more about what you guys do with HMR, because we love working with you guys. I mean, we've been doing these webinars and seminars now for many years, and I can't imagine doing it without you guys. So tell us just a little bit more about what you guys specialize in, and then we'll bring Ted in for the special coffee giveaway.
No, absolutely, Ginger. So, if I haven't met you yet at some of these wonderful conferences and things like that, please make sure to come up and say hi to me next time we run into each other. But HMR Servicing, we are the premier funding source for personal injury plaintiff law firms nationwide. We do specialize in catastrophic injury cases. Traumatic brain injury, spinal cord damage, amputees, the full gamut, right? And there are, as Ginger mentioned earlier on in the program, there are 3 types of funding that we do offer to attorneys in order to support them through their case. The first of which is case cost funding. So experts, right? Experts like Dr. Smallwood, experts that you need to shore up your case, right? And life care planners, trial consultants, these can become a heavy lift. These experts, well, at least the good ones, the ones you want, don't come cheap, and it can be costly, multiplying that by however many cases you have. So we can step in and help you out with that heavy lift. The second of which is going to be medical funding. Like I said, we are nationwide. We currently operate in 39 states for medical funding. Why do I say that? I bring that up to let people know that we do have providers nationwide. I have a wonderful network, people like Dr. Smallwood, for these specialized cases and things. So if you're ever in need of that, please feel free to reach out, bounce it off me, say, hey, Bleu, do you know someone? I probably do. And last but not least is going to be the pre-settlement funding piece. This is a hard time for your client, right? Possibly the hardest time that they've ever had to go through in their life. They may not be able to work. Things may be tough. They may need to pay their mortgage, right? We can step in and help out and get them the funding they need to get through this period. But anyway, that's pretty much who we are in a nutshell. We're very easy to contact. I will leave my information in the chat box as well. And now we're about to give away some coffee. So with that being said, Ginger and Ted, take it away.
I know it would not be a Connectionology webinar unless we had Ted here to give one lucky winner this special coffee that again has been sweeping the nation. I know we're not Oprah status yet where we can give away cars, but I tell you, this coffee will keep you awake and keep you working all day. So Ted, it is great to have you with us. I know you're going to announce the winner, but also talk about the party that you guys have coming up at Lanier's big trial academy.
Yes, I'm excited. It's our 4th year in a row to be having our HMR After Dark party on opening nights. That's June 18th during the Lanier Trial Academy in Houston. So if you're going to be at the conference, be sure just to walk right across the street. I mean, right across the street to the grotto and enjoy some cocktails, some freshly rolled cigars. And it's just going to be an awesome time. So really looking forward to it. And what everybody's waiting for is our coffee winner. So some 4 bags of great Ethiopian Yirgacheffe, and it is Drake Hood out of Gresham, Oregon, and first time winner after all these years. So that's fantastic. So
Yay.
congratulations, Drake.
Congratulations. All right. Well, Ted, you and myself, we will both reach out to Drake after this webinar and make sure that he gets sent this coffee. But don't worry, guys, if you didn't win today, there's always a chance tomorrow because we will be giving away even more coffee. Right, Ted?
Yep. So looking forward to it.
All right. Well, thank you guys so much. And again, please, if anybody is going out to Lanier's program, be sure to stop by this wonderful party that HMR is organizing. I've been to several of them and they are a lot of fun and you get to meet a lot of great people too. So thanks, Ted, for all that you do.
You're welcome.
And Blue, I think that is it as far as questions. I'm just getting a lot of great comments, Dr. Smallwood, where everyone says, thank you so much. Great presentation. We're really happy that everybody watching has found some value in today's webinar. Like I said, it was very special and unique, and we wanted to do something we've never done before. And I'm really excited because I would love to have Dr. Smallwood come back and do some more webinars. But also, last, I just wanted to mention that Dr. Smallwood, aren't you the founder of like a sleep, like Desert Sleep? Is that correct?
Yes.
Out in Arizona. And that's a whole nother area that we can get into. We can talk about that as well.
Yeah, it's a very hot topic, and sleep apnea is affecting, over 70% of the population, very light sleep apnea issues to very severe sleep issues. And we just have a lot more stresses in our life, and it's affecting all of us to a degree. So and it can be something as simple as snoring to the potential of the stress it's having on your heart. So all of those can lead to quality of life, good and bad things. So absolutely, it's the bottom of it is sleep. We're not getting enough sleep as Americans. Absolutely true.
I agree. Well, I look forward to getting into that.
Okay.
And if you guys give me a few minutes, I will email you all of the follow-up information from this webinar, as well as the contact information again for Dr. Smallwood, so you can stay in touch, for Bleu, and for all of our great partners at HMR, OnPoint, FAACD, and Emotion Track. I just want to thank everybody again for watching. I really appreciate your time today, and I hope you enjoyed it. Does anyone have any last-minute closing comments before we head out?
I thought it was fascinating. So it was really great to watch. So thank you, Dr. Smallwood, for your presentation.
Yes, thank you. Appreciate it. I enjoyed it.
All right, guys. Well, thank you so much for being here with us, and we will see you again tomorrow at 3 o'clock. I will also be posting this webinar to our Connectionology YouTube channel, so that way you can refer back to it. You can share it with your colleagues, and definitely subscribe if you haven't already. Thanks, everybody. Have a great afternoon.
Thank you.
Bye, everyone.